This is CGTN, China Global Television Network.
Health unions in Tunisia have urged the government to create a national agency for the rescue of the public health sector. Tens of thousands of doctors and medical students protested against what they described as a disastrous situation. Unions called for increasing the health ministry's budget, upgrading hospital infrastructure and paying the debts of all healthcare facilities.
Thousands of striking Tunisian medics and hospital staff staged an angry protest over the country's crumbling public health infrastructure. Protesters marched from the Faculty of Medicine in Tunis to the Health Ministry. Doctors staged a sit-in near the government palace, demanding urgent reforms of the public health system and better working conditions.
We are protesting nationwide to show that all healthcare professionals are angry because of the bad situation and the deep crisis in the whole healthcare system, from infrastructure to the backward legal tax from the 1960s, which regulate the profession, as well as the lack of means at hospitals.
According to the National Council of the Tunisian Medical Association, at least 50 doctors and 300 paramedics died from the COVID-19 after being infected while treating patients during the first as well as the second wave of the pandemic.
We can no longer work in these conditions both in private and public sectors, which are buckling under the strain of the pandemic. We are worried about the new generation of doctors who are risking their lives despite the lack of equipment. The number of deaths among medics and paramedics is on the rise, while the authorities are passive.
The government acknowledged the difficulties and promised to increase the budget of the health ministry. The country's premier also declared that the state will improve the working conditions at all health facilities and COVID-19 centers.
During this ministerial meeting, allow me to thank all the sons and daughters of Tunisia. I hope they're safe amid this dangerous health situation. We are following up on the development of the health situation and managing coronavirus while improving the conditions and the means to fight the pandemic.
The death of a young doctor in a lift accident sparked outrage among healthcare workers. Badruddin Alwi, 27, died last week after falling down an elevator shaft when the doors opened with no lift in place. His death also sparked calls for the health minister to resign. The Tunisian Association of Young Doctors has denounced the failings of the country's long-neglected healthcare system. Authorities say an independent national committee will be responsible for monitoring the reform of the health sector within a period of 1 month. Abdel Shawishi, CGTN, Tunis.